What is inattentive ADHD presentation, and why does it lead to later stage diagnosis, as well as people being underdiagnosed and undertreated? I'm Dr. Heidi, your med mentor. I have ADHD and I'm a physician. Share this with somebody you think might be interested in learning more about this, and follow me if you like learning about ADHD. This paper talks about how the inattentive presentation of ADHD might be the most highly represented of all of the types of ADHD. We talk about presentation of ADHD as a different shift in our language now, more than we talk about subtypes of ADHD, because as this paper discusses, inattentive symptoms will persist over time, but hyperactive symptoms sometimes will wane as people get older. Inattentive presentation of ADHD tends to have a lot more internalizing symptoms than the hyperactive subtype. Things like anxiety and depression. There was another paper I actually read recently that talked about how women tend to be underdiagnosed because they get misdiagnosed with things like anxiety or depression first. This is one of the reasons I advocate so fiercely for comprehensive psychiatric evaluation when getting an ADHD diagnosis. It's going to give you information about your specific presentation and how best to go about treating it. It's also going to give you information about underlying comorbidities, because data suggests that up to 60% of people with ADHD also have other neuropsych conditions like depression, anxiety, and you might also have like a processing disorder, for example, dyslexia. Or perhaps you have ADHD and there's an underlying component of autism as well. This paper also mentions a gender bias with respect to females having a higher diagnosis rate of having the inattentive subtype. This could also contribute to why women tend to get diagnosed at later stages in life, because these symptoms tend to present with more masking. It's not as obvious in the classroom setting as a hyperactive kid who's running around and causing a ruckus in class.